Welcome, everybody. Thank you so much for joining us this evening. So today we are actually speaking to you about the thyroid and kidney health and how these two very important organs are linked together. One of the things that this really underscores is how important it is for us to be looking at the influence of all the different parts of the body on each other, and looking at things as a whole rather than just looking at individual parts. I know that very often we go to a practitioner and they just start looking at the one thing that we're having an issue with, and it may be something else in the body that's influencing that and causing some dysfunction there. So the kidneys and the thyroid are connected in some really important ways. So these two organs are both critical to our overall well-being. And they are closely linked in a lot of ways, and most of us don't really realize that. So today we're going to be kind of talking through that relationship a little bit. So let's start with opening up the PowerPoint, and I'll share this with you guys. Let's start with going over kind of what the kidneys and the thyroid actually do in the body. And so the kidneys are responsible for filtration, for regulating electrolytes, for signaling red blood cell production in the bones, filtering waste from the blood, a lot of different things, also maintaining blood pressure. And they're two just kind of bean-shaped organs that sit right underneath the ribs, where the ribs meet the spine in the back. And so they're crucially important to our body's function. The thyroid, on the other hand, is a little butterfly-shaped gland, and it's located right here on the front of the neck. And this also has a huge impact on our body. It actually produces thyroid hormones that control our metabolism, our energy use, our growth hormones. These hormones affect everything in our body, including body temperature and heart rate, weight, things like that. So also a very important organ. So, as I said, the kidneys are responsible for filtration, and they filter about 50 gallons of blood every day, so quite a bit, removing waste, removing extra fluid. All of these are excreted as urine. And they also regulate the electrolytes like sodium and potassium, which are essential for muscle and nerve function. So in addition to that, kidneys also produce erythropoietin, which is a hormone that helps the body to produce red blood cells. And they also maintain blood pressure by balancing fluid and salt levels in the blood. So, thyroid. The thyroid actually produces a hormone called T4, which then has to be converted into another form, which is T3. And that's the form that the body can actually absorb and utilize at a cellular level. And so it's really important that conversion happens. So these hormones are really critical for regulating metabolism, how the body uses energy, how quickly our heart beats, how we digest our food. When the proper balance of without the proper balance of thyroid hormones, our bodies really just don't function properly. So if the thyroid produces too much thyroid hormone, we can develop hyperthyroidism, which speeds up our metabolism and causes symptoms like excessive weight loss, rapid heartbeat, anxiety, things like that. If the thyroid actually produces too little hormone, then it leads to weight gain, fatigue, depression, kind of sluggishness, a lot of those kinds of symptoms. So how are they connected? That's the question. And it's actually a two-way street. So the health of one organ can impact the other. And so the kidneys actually will impact the thyroid because the T4 is converted into its active form of T3 in peripheral tissues, especially in the liver and the kidneys. And so if the kidneys are not functioning very well, then we're not converting that into the T3 that the body can actually absorb and utilize very well. And also that reduced conversion Also is characterized by mildly elevated thyroid stimulating hormone, which is the hormone from the brain that tells the thyroid to make the hormone. And this can also kind of throw things off and just mimic the symptoms of hypothyroidism. So frequently, even if the thyroid is functioning properly, it's still showing up like hypothyroidism because the kidneys are a little off. So it also alters the thyroid binding, the binding of the thyroid hormone to protein in the blood, particularly albumin. A lot of times when we have kidney issues, the albumin is low, so we don't have those proteins to bind the hormones to. And those actually help in their utilization. It also increases the inflammation in the system when the kidneys are not functioning well. And it causes the body to release pro-inflammatory cytokines. And these are things like interleukin-6, which are interfering with the hypothalamic, pituitary, and thyroid axis. And this all regulates our hormone production. So it can cause our hormones to be out of balance. And also when we're releasing a lot of cytokines, this is a hallmark of things like autoimmune disease, and can contribute also to not having enough of that T3 for the body to use. So it just works on a lot of different levels. And so when the kidneys are not happy, the thyroid is not happy. It also changes the way that we metabolize iodine. And iodine is essential for thyroid hormone synthesis. So the kidneys are less efficient at reabsorbing iodine, leading to lower iodine availability in the body and the thyroid not functioning as well as it would otherwise. So on the flip side, the thyroid also has an influence on the kidney. Now, the thyroid's influence on the kidney is a little less direct. Mainly the thyroid influences the cardiovascular system, and the cardiovascular system has a major influence on the kidneys. So if the thyroid is not functioning very well, it can cause fluid retention, increase the risk of developing high blood pressure, and also can damage the kidneys when we have high blood pressure. So hyperthyroidism actually leads to a faster heart rate and also kind of overdrives the kidney's filtration system. So it's really, the faster the heart is pumping, the more that the kidneys are having to filter. And so it kind of overdrives that system, which eventually can harm the kidneys if it continues. So increased blood pressure. And the increased blood pressure, again, leads to the blood vessels in the kidneys being damaged. The blood vessels in the kidneys are very, very delicate. And so it doesn't take a whole lot to damage those. This is one of the reasons that we see kidney issues in diabetics, because diabetics also have issues with blood pressure, cardiovascular disease, and that ends up causing cardiovascular issues in the kidneys. So it's really important that the blood flow in the kidneys is not too much, not too little, right? Just right. And then frequently in hypothyroidism, the reduced heart rate and the lower cardiac output also results in reduced renal blood flow. So blood pressure and blood flow are two different things. Blood pressure is when there's more pressure put on the blood vessels. The blood flow is how much blood is moving through those blood vessels. And so ideally, we want more blood to be flowing through the blood vessels because that brings oxygenation to the tissues. The blood is what brings us oxygenation. And so if we have higher blood pressure but lower blood output, then we actually are not getting the oxygenation to those organs that we need. And that lack of oxygenation also will cause dysfunction. So the fluid retention also can cause edema, which is swelling, and can also further damage the kidneys and reduce kidney function. So we also have a lot of times with hyperthyroidism, what we call tachycardia or arrhythmias. And so this is a rapid heart rate or an arrhythmia is an imbalanced heart rate. And so that irregular heart rhythm a lot of times can cause poor cardiac output, which then leads to reduced oxygenation, and then we're not getting the oxygen to the organ, and can also lead to damage. So the other thing that can cause an issue is electrolyte imbalances, and the kidneys actually control the balance of the electrolytes. So if there's too much, if there's too little, if there's too much, then they actually flush some of that out. If there's too little, then they reabsorb some of that from the other systems. So they really do help in balancing the electrolytes, and those are crucially important also for all of our function. So the important thing, how can we support these systems? So it's really important for us to be supporting all of our body systems. And interestingly, the answer to most of this is the same as the answer to everything else, right? So some of the foundational things are nutrition, hydration, sleep, physical activity, stress, right? We talk about that all the time. If you're one of my clients, you've heard this. But some of the things that we can do specifically to help balance the kidneys and the thyroid is maintain a balanced diet, right, that provides all of our essential nutrients for both the kidneys and the thyroid. We really need to be focused on whole food nutrition, which includes fruits and vegetables, which are rich in antioxidants, vitamins, minerals, lean proteins, so things like fish and chicken, to some degree, legumes, vegetables actually have a remarkable amount of protein that people are not aware of. Healthy fats like avocados, olive oil, nuts, seeds, things like that. Also, some of the thyroid supporting nutrients in particular are things like iodine. Iodine is really necessary for thyroid hormone production, but we have to be in balance with the iodine, right? Too little iodine will decrease thyroid production, but also too much iodine will cause an issue with the thyroid. One of the things that we discovered when they started putting iodine in salt, they started that in Minnesota because Minnesota is far from the ocean. A lot of those people, their genetics are far from the ocean, and so they don't absorb iodine very well. And so they thought, oh, well, we'll just put iodine in the salt. Everybody eats salt. And about a third of the children there actually were dealing with goiter, which is a symptom of low iodine. And so within, 6 months or so, they found that was really beginning to correct itself just from putting the iodine in the salt. The downside was that about a year later, they started noticing a high incidence of hypothyroidism because they were getting too much iodine. So not enough is not a good thing. Too much is also not a good thing. So that iodine needs to be in balance. Selenium is really important. It plays a role in the conversion of the T4 hormone to T3 hormone. You can find that in things like Brazil nuts. Those are a wonderful source. Also sunflower seeds and some degree fish. Zinc is really important for our immune health and also for thyroid function. You can find that in pumpkin seeds, shellfish, legumes, beans, peas, things like that. And then vitamin D. Vitamin D is really crucial to thyroid health. And Getting enough sunshine is really important, but unfortunately, most of us are indoors all day. We're really not getting that high level of sunshine. So taking a D supplement is, for most people, a good idea. Should definitely be working with a practitioner and testing those things, but definitely vitamin D is really important on a number of different levels. So the kidney supporting nutrients that we're looking at are things like potassium. Although again, with the kidneys, the potassium really needs to be in balance. Not enough is not a good thing. Too much is also not a good thing. Phosphorus is another one. Phosphorus is an interesting one. This one we find that the balances very frequently are interrupted by heavy metals. So either blocking receptor sites so that we have a lot of phosphorus circulating in the system that's not being absorbed, or blocking us from absorbing phosphorus at all. So we're not even getting enough phosphorus in the system. So high phosphorus foods include things like processed meat and sodas. So it's really not a good idea to be eating those things because we can cause an overabundance of phosphorus, which is really hard on the kidneys. But we definitely need enough. Sodium can also be damaging to the kidneys at too high a level. So really keeping the sodium in check. And, a lot of people are really careful about the salt that they put in their food. But really, if you're using a good salt, that's not as much of an issue. It's really the salt in the packaged processed foods and also in restaurants' foods. Things are incredibly oversalted in restaurants. A lot of times we find that there's an entire day's worth of sodium in one meal. So just to be aware of, usually the foods we make at home aren't as much of an issue, but the packaged processed foods, the salty snacks, things like canned soups, processed meats, things like that, those can also be really high in sodium. So it's really important to be aware that the sodium can also be a really big issue for the kidneys. So hydration. Definitely one of my favorite topics. It's really important that we get enough water. It really keeps the flow moving in the kidneys. It's really important and very protective of the kidneys in later life. So if you stay really well hydrated throughout your life, then your kidneys will be much more protected as you age. So water is crucially important. It's also really crucially important to be getting clean water, right? And we talk a lot about this at the center. The water really needs to be purified. We generally recommend reverse osmosis or distilled water for people. I usually recommend putting a little pinch of salt or some electrolytes in your water just because it really does strip out all of the minerals, but it's really important that it be clean and that it be clear of toxins. A lot of what the kidneys do is filter out toxins. And so if we're really putting a heavy toxic load on those kidneys, then it's absolutely going to have an effect on how they function. So the pure water is really important. It's also really important to the thyroid function because the thyroid is actually really sensitive to toxins. Usually we see the toxins in the body affect the thyroid first. Usually first thyroid, then pancreas, then we start to see it show up other places. But really the thyroid is very sensitive to toxins. So that clean, pure water is really, really helpful. So there are also some herbal teas that are really beneficial for both the kidney and the thyroid. The dandelion tea is, especially dandelion leaf, is very beneficial for the kidneys. Dandelion root is more geared towards liver health, but dandelion leaf is really beneficial for the kidneys. Also, nettle. Nettle is a mild diuretic, so a lot of times it can help flush things out of the kidneys if we have some toxicity built up there. And then ginger is just really kind of good for everything. I highly recommend taking ginger tea. And but it can really be helpful for maintaining the function of both the kidneys and the thyroid. So physical activity, our bodies are made to move. You know, when we evolved in the Paleolithic era, we were walking around all day and looking for food and chasing food and climbing trees and digging things up and, you know, having to build our own shelters. And now we really aren't having to do much of that. And so we're really not getting the high level of physical activity that we used to. And so we really need to find ways to kind of work that into our days. One of the things that I love to recommend for people is just stop a couple of times throughout the day, do a little bit of deep breathing, do a little bit of exercise, get a couple of minutes in just to kind of get the heart rate up and get the blood pumping a little bit. And just do that several times throughout the day. It is cumulative, so it makes a difference. And so we also need to vary our exercise. We need to get a broad spectrum of different types of exercise. So aerobic exercise, of course, is really important to cardiovascular function. It gets the blood moving, it gets the lymph moving, right? It's the respiration going, which helps our lungs detoxify us. But strength training is also really important. Building that muscle is crucially important. That helps keep our blood sugar in check. That also helps help us build better energy. So it builds our mitochondria so that we actually create more energy in the system. We want to aim for, you know, at least 150 minutes a week of moderate intensity exercise. So that's something that gets your heart rate up, gets you breathing a little bit heavier. A lot of times you'll still be able to talk while you're doing moderate intensive exercise. But if somebody was talking to you on the phone while you're doing that, they would notice, you know, they would notice that you're breathing a little heavier. So we definitely want to get about 150 minutes of that moderate intensity exercise every week, and then also a little bit of strength training. And, you know, the one that I didn't put on here, but we really should mention is also stretching. Stretching is really important. We very often will injure ourselves if we're not stretching properly. And all of this is really important in weight management, obviously, but doing all the things that are also important in weight management, eating properly, all of that, maintaining hydration is also really important for taking the pressure off of the kidneys. When we're carrying a little extra weight, it does tend to cause our blood sugar to spike a little more, and that's going to have a major impact on the kidneys. And so maintaining a healthy weight will also help with blood pressure and some other things as well. So paying attention to that is going to be really important. So stress management. Obviously, we're not going to get rid of our stress. We know this. We live in a fast-paced world. Things are kind of flying at us all the time. So it's really important that we learn to manage our stress, do some things that really offset that, but also learn how to connect with our stress a little bit better. You know, a lot of times we worry about things that never happen. Like 80% of the things that we worry about never happen. So really connecting with stress in a different way is really important as well. And then considering, you know, what are we feeding ourselves? Not just physically, but what are we feeding ourselves mentally? What are we feeding ourselves emotionally? Who are we hanging out with, right? Are those people giving us more energy, or are they sapping our energy? You know, are they positive and upbeat, or are they negative and, you know, constantly complaining? So that really makes a difference as well. And, you know, only we can choose where we are, who we hang out with, what we're listening to, what we're watching, what we're reading. You know, so that's a really important piece of that as well. What are we feeding ourselves? But also, there are techniques for reducing chronic stress. Meditation is wonderful. And, I have a lot of people tell me, I try and meditate and I can't make it work. It's just too hard. I sit down and my brain is all over the place. Yes. Yes, that's what's supposed to happen. It's a matter of practice, right? So what we practice, we get better at. And it's a matter of training the brain that when we start to sit and breathe and get into that calm, relaxed state, that it's time to be quiet. So it does take practice. It does take, doing this over and over and over and repeating it. The brain is like a 2-year-old and you have to tell it a lot. So it's really just doing that over and over and over and over. And before too long, you find if you practice regularly that you'll sit and you'll start to breathe and you'll start to do the routine and the brain goes, oh, I know what we're doing. Okay. And it just quiets. So even the Dalai Lama said, you can't expect for your brain to be quiet. That's not what it does. He said even his brain, when he sits to meditate, it just wanders off sometimes. So the expectation should be that, yes, it just takes practice and sometimes just sitting and breathing with no expectation of getting into any kind of a state, but just sitting and breathing and allowing ourselves just to be makes a really big difference in our stress levels. So yoga is also very good. It was actually designed to connect our mind and our body. And so often that's what's missing. We're breathing shallowly because we're stressed. This allows us to get into that deep breathing and also to breathe in conjunction with our movement. And so that also helps to promote that ability to sit and meditate. It was designed as basically something to get the mind and body working together so that it was possible for us to sit and meditate. So yoga is really beneficial for that as well. Breathing exercises are wonderful. One of the resources that I like to share with people, there is a website called Oxygen Advantage. And it's Patrick McCown, who is a breathing expert. And he's got all kinds of wonderful resources, free breathing exercises. He has an app that's phenomenal, and it's all free. So I highly recommend checking that out. And it really gives you resources for doing the breathing exercises. And those over time will actually lower your cortisol levels and improve your heart health. So the other piece of stress management is really getting adequate sleep. If we're not getting adequate sleep, if we're not getting that 7 to 9 hours of sleep a night, and also if we're not getting a good quality of sleep, then it really impairs our ability to be resilient in the face of stress. So when we are stressed, when things, everything falls apart, right? Because that happens on a regular basis to all of us. But when, things are really busy, really stressful, not working well, having that good quality sleep and plenty of it is really going to allow us to connect better with our stress. It allows the brain to work better. It allows us to be a lot more resilient. So I cannot even stress enough the importance of sleep. So another factor in our overall health, and especially in our kidney and thyroid health, is processing toxins. So we live in a toxic world right now. That's just the fact. But it's really important wherever we possibly can to reduce the toxic burden on the body. The more that we can reduce the toxic burden on the body, the better it's going to function. So it's really crucial for us to avoid those toxins wherever we can. So things like limiting alcohol consumption is really important. Excess alcohol can damage the kidneys, disrupt the thyroid function. It also really impairs our sleep. So even if, we only just have a drink or maybe two, and then we go to bed and, we sleep okay, we don't really notice it, but we're not really getting into that good, deep sleep that the body needs in order to repair itself. The alcohol actually inhibits that. So limiting alcohol consumption is really important. Obviously, if we're smoking, you need to quit smoking. That harms the blood vessels, which of course is really important to the kidney because those blood vessels are very delicate. And of course, because that smoke is going right through that whole throat area, right through that area where the thyroid sits, it can really have an impact on the toxicity of the thyroid as well. So that's really important. Certain medications can be a big factor in that toxic load. Things like NSAIDs, which are the non-steroidal anti-inflammatory drugs, diuretics, painkillers, things like that can really impact kidney health because the kidney is a filter, and so it has to filter out those toxins. Those also have a tendency to throw the balance of the gut microbiome off, which then impacts everything. So avoiding taking those medications excessively wherever you can. I mean, every now and then, yeah, we might need that, right? But relying on those solely, much better to figure out what's going on there and correct the problem if possible. The other thing that we really, really need to focus on avoiding are endocrine disruptors. And unfortunately, those are ubiquitous. Those are everywhere in our environment today. A lot of these come from plastics, and we are surrounded by plastics these days. So plastics, things like BPA, which they've kind of touted that they removed all the BPA from everything, but they replaced it with something. And those soft plastics that they replaced that BPA with very likely are also endocrine disruptors. And so it's really important for us to stay away from those. Those upset the balance of our hormone balances. So they can interfere with our kidney function and our thyroid function. And of course, then the kidney has to clear those as toxins. So it's really important for us to avoid those wherever we can. Choose organic foods. Use natural cleaning products. A lot of the fragrances that we use in our homes have xenoestrogens and endocrine disruptors in them. So using essential oils and things like that as opposed to synthetic fragrances is really helpful there. So there are a few supportive herbs and supplements that can be really beneficial for the kidneys and thyroid. And a lot of these we actually carry in the office. It really helps to be working with a practitioner if you're navigating that, because a lot of times we can tailor that to your specific needs. But some of the herbs that support the kidneys are, as we spoke about earlier, the nettle leaf and dandelion. This is dandelion root, but that's not accurate, so sorry. Look for dandelion leaf for the kidneys. Turmeric is also really good for reducing inflammation. So reducing inflammation is very helpful for the kidneys. Herbal supports for the thyroid include ashwagandha, which is an Indian herb. It's adaptogenic. So if things are overworking or underworking, then an adaptogen is going to just balance that out. So if we're having hyperthyroid, it's going to reduce that function. If we're having hypothyroid, it's going to start bringing that level back up. So ashwagandha is a really good adaptogenic herb for that. Google is another Indian herb. They use it a lot in herbal preparations to support the thyroid and also to promote a healthy metabolism. Bladderwrack is actually a sea vegetable, and it's naturally contains iodine. A lot of the seaweeds and sea vegetables are plentiful in iodine. So those are a really good way to get enough iodine for the thyroid, but they're not going to have so much iodine that it's going to overdrive that. So through food is a really good way to get the thyroid or get the iodine that you need. So some of the supplementation should only be, if necessary, based on testing and should be monitored closely. So things like if you're taking an iodine supplement, then it's really important that you make sure that you're getting enough iodine, but not too much iodine. So testing periodically and really paying attention to that is really helpful because you don't want to overdo that. Same with selenium. Selenium, if you're getting it from food sources, generally it's not going to be overdone. It's not going to be too much. But if you're actually taking a supplement, a lot of times I find that people are taking way more than they actually need. It is important for thyroid health, especially if you have hypothyroidism, but it's also important not to get too much of that. And then vitamin D also. Vitamin D is crucial, for all functions in the body, and sometimes supplementation can be useful there. It's really important, though, to know whether you are absorbing your vitamin D, though. If you're not absorbing your vitamin D and you're taking a whole lot of vitamin D, then it can just be circulating in the blood and you can get too much of that. So that's not a good thing. So, as I said, it's really important to do regular monitoring, regular screening, pay attention to the nutrients, whether they're high or whether they're low, but also really doing checkups on the thyroid hormone production, how much T3 you have circulating, whether your thyroid stimulating hormone from the brain is working well. All of those things are really important to test. And there are a couple of other things that I generally recommend for people that they have tested if they're doing a thyroid panel. The kidney function tests include creatinine and GFR, which is glomerular filtration rate, which is basically the rate that your kidneys are filtering at. So these should all be part of regular assessments. Also, regularly screening for high blood pressure, keeping a monitor on that. If you have a tendency towards high blood pressure, it's really important because the high blood pressure can really damage the kidneys. So having your regular testing is also super important. So just to kind of conclude all of that, these are just two organs that have a relationship with each other. And really, our systems are not operating in a vacuum. Our organs are not operating in a vacuum. They all interact with each other. And so if an organ starts to have a dysfunction, then it can affect everything else in the body. So it's really important to be paying attention to those relationships and looking at things as a whole rather than only just looking where that dysfunction is happening, because it may be coming from somewhere else. So we want to understand and manage our overall health and really do the things that are going to be overall supportive and make sure that there's not something that you are missing. So with that, I will unmute, maybe. Sorry, bear with me. Technology. Okay. Still didn't. Okay, so I unlocked it so that you are able to unmute yourself, but if you have a question, you will have to unmute yourself and feel free to ask any questions that you have now. stop sharing my screen. There we go. So, any questions?
Could you talk a little bit more about the GFR, GFR in kidney tests?
Yes. So the GFR stands for glomerular filtration rate. And basically, all that's saying is just that it's the rate at which the kidneys are filtering. And so if the kidneys are being overdriven, like in the case of hyperthyroidism, then they're filtering way too much, way too quickly. And so that can cause ultimately kind of a burnout effect in the kidneys. If they're not filtering enough, that's a different issue, right? Because then you're not filtering your toxins well. And so having that tested with your regular blood testing, it's a really important marker for how well the kidneys are functioning.
Thank you.
Yes.
I have a question. Let's do this first. Put myself okay. Oh, what is the recommended range for selenium levels, potassium, and phosphorus levels?
I couldn't tell you that off the top of my head, but we do have really good testing that we do. We actually do oligoscan testing, and the oligoscan tests for heavy metals, which is awesome, but it also tests for levels of minerals and vitamins. Okay. And it really gives us all of those ranges, but it's going to be just a little bit different for everybody. And also, it's important to make the distinction between those levels in serum, which means floating around in the bloodstream, and those levels that are actually getting into the cells, right? And so that's one of the reasons I really love the oligoscan testing, because it tells us what's getting into the cells. It's really testing at a cellular level. Now, in order to get the serum levels, you would have to do blood testing. But those two together can be really powerful, because it can tell us not just how much you have, but also how well you're absorbing it. So that's important to know about testing as well.
Okay. Yeah. I have another question.
Sure.
So I used to live in Dallas in 2017. Mm-hmm. I'm since in Kansas City. I'm trying to come back to Dallas. Mm-hmm. But do you know of any practitioners such as yourself that is in Kansas City that you could possibly refer me to? Because I attended the thermography.
Mm-hmm. Yeah, I don't know of any specific practitioners. We do work with people all over the country.
Oh, do you? Okay.
We do. We do a lot of telemedicine.
Okay.
And, so now, obviously, you would have to come to Dallas, get your testing done.
Yeah.
But yeah, we actually work with people all over the country, and regularly do telemedicine by Zoom. And so, yeah, we could absolutely help you there.
Okay. Good to know. Thank you.
You're welcome. What else?
I have a question. Hi, Dr. Marta.
Hi.
What would cause someone to not be absorbing vitamin D?
So one of the things that very frequently blocks the absorption of vitamin D is mercury. Mercury, and then some of the other heavy metals sometimes will block that. But that, and then also gut function. So how well your gut microbiome is functioning really also dictates how well you're absorbing vitamin D and most of your other nutrients as well. So very frequently, those are the things that we see blocking the absorption of vitamin D, because often I'll see at a cellular level, the vitamin D is very low, But then if we go have a blood test done of what's floating around in the bloodstream, that's very high. And so that tells me that somebody's getting enough vitamin D, but they're not absorbing it well. And so then we really have to look a little deeper. And this is where we talk about, the different areas of the body affecting other areas of the body, right?